Vitamin D is a really common point of discussion in a lot of circles these days. It's a hormone, not a vitamin. It's misnamed, and our bodies make it. The previous discussion that we've had on normal ranges kind of pertains to this because vitamin D also has normal ranges, but that assumes that everybody that was put into the normal range group didn't have vitamin D deficiency or vitamin D excess. And so the normal ranges are kind of up for discussion. And then just understanding a little bit about what we mean by vitamin D, the active form of vitamin D is usually not measured. Now, there are some circumstances where it is, and that form is called 1,25-dihydroxyvitamin D, or its other name is calcitriol. That's often not the appropriate vitamin D level to measure. Unfortunately, many physicians and other providers actually don't know that, and so they inadvertently will order that one, and it's not a particularly helpful test. What we want is the 25-hydroxyvitamin D, which has a couple of other names as well. The one that I usually use is calciferol, and that one is not an active form of vitamin D. And different labs have different normal ranges, but the majority of labs in the United States have a normal range of 30 to 100 nanograms per milliliter. That, of course, includes anybody that might have vitamin D deficiency and anybody rarely who potentially could have vitamin D excess. And so this normal range is probably not optimal. And from my own experience, I think that the optimal range is greater than 60. I do have a colleague who has a good amount of experience with this, who is of the opinion that vitamin D optimal ranges are perhaps 100 to 140, which would be completely above this range. And then you'll see other physicians that are vehemently opposed to that and will say that that's vitamin D poisoning. It's very difficult because we do not have settled scientific consensus on this. But vitamin D is a very important hormone. It has a very important role to play in bone metabolism, calcium management in the body, as well as the immune system. So I've kind of come to the opinion that shooting for a range of 60 to 100 is pretty good. I do have pretty good information from my own research that suggests that less than 60 really isn't good. So I think 60 to 100 is a good range. But when I find somebody that we've inadvertently made their level 125 or 143 or something like that, I have never had a case where someone has been hurt as a result of that. So I might modify their dose a little bit, but I don't worry about it. And it certainly is not associated with bad outcomes. We go into greater detail on this in our more extensive discussion on vitamin D on the Healthcare website, and we'd encourage you to look at that.